Welcome to data extraction for the ACP project. We have created this video to guide you through the data extraction form and our expectations for extractions. Data extraction will take place in Excel. You will complete the extraction in pairs, and each pair will have 25 articles to extract. You should first extract independently and then confirm your results together. At the end, we would like to receive one complete document that represents the combined and agreed upon results from the pair of reviewers. The timeline of completing the articles will be within 3 months of you receiving your assigned articles. Although we are giving you 3 months of time, earlier is always better if it is possible for you, and if you wish to extract more articles, we will be happy to assign more. There are 5 sheets in the Excel document. The first sheet is General Data Abstraction. In this sheet, you will record study characteristics, study level covariates, and risk of bias. This sheet is set up as one row per study. The second sheet is the Outcome Extraction sheet. This sheet is where you will extract all of your outcome data. This sheet is set up as one row per study arm. The third sheet is the codebook. This is a locked sheet that holds the options for our drop-down menus. You won't be able to use or modify this sheet, and for the most part you will not need to refer to it. However, I will draw your attention to the 2 yellow highlighted boxes. Cells must be recorded as NR when data is not reported. So for instance, if the study does not report the age of the participants, you will record NR. Cells must be recorded NA when there are fewer arms than the maximum. Our data extraction sheet has room for up to 4 armed studies. If your study has 2 arms, you will record NA in all of the fields for arms 3 and 4. If the study does not report one of our outcomes, you will enter NR. You will also use NR in the outcomes sheet if the study does not measure one of our outcomes of interest. This is to make sure that there are no empty cells when the statistician goes to work. If there is an empty cell, Benham will have to go back and check the article to make sure that you didn't miss something. By putting NR and NA in the sheet, he is confident that you did not miss anything, but that there is no information for that field in this paper. And please fill out all of the cells in that field, not only the first one. In our 2 practice studies, neither of them reported health-related quality of life, so we put NR in every cell. The 4th tab is our risk of bias guide. We have tried to make it extremely thorough and with a particular emphasis on non-drug trials, which we believe the majority of our studies will be. It includes guidance for answering questions about sequence generation, allocation concealment, and blinding. We will come back to discuss this sheet when we go over the risk of bias section of the data extraction form. The 5th and final form is a calculator. This is an important sheet because it serves as a calculator for you. As a for instance, your study may report the mean age of each arm rather than for the total sample, and we want a mean only for the total sample. So in the pooled means section, you can enter for each group the mean of the group and the sample size, and it will provide you with a pooled mean, which you will then enter into the data extraction form. Note that if duration of pain or age are reported as a median for each arm, treat the median as a mean, and then use the calculator to generate the pooled median and insert that in the form as a mean. Please note also that in some of these cells there's a formula. Please be careful not to accidentally delete the content of these cells. Now that we understand what each of the sheets are for, let's move to the general data extraction form. First, we have basic information on the study and participant characteristics. The ref ID is a unique number assigned to each study. Please fill out the first author's last name, the year published, and your name as the reviewer. Our first column is age. Here is where you may need to use the pooled means calculator. You don't need to fill out a standard deviation for age. The second is the duration of pain in days. You may notice that our 2 practice articles both reported the duration of pain in units other than days and for each arm in the sample. In this case, We use the pooled means calculator to calculate the pooled mean in the units given, so in the case of first study in hours, and then use Google to convert from hours to days. So just go to Google and search hours to days and it will provide you with a calculator. This is much easier for us than to provide you with all of the possibilities in the calculation sheet. Again, we don't need to capture standard deviation for the duration of pain. Then note the clinical condition, the location of the injury, and the tissue type. Tissue type is a drop-down menu. Your options are bone for fractures, connective tissue for things like strains and sprains, muscle, nerve, and mixed. We then need to know some information about the severity of the injury in columns J and K. This will be difficult because many different types of injuries will have their own index and some don't have an index at all. In the case of our first article, ankle sprains have an official severity index, which I indicated here with a little help from Google for understanding it. For the second article, the only indication of severity that we found was the mean pain scores for the groups at baseline. Please locate the information that makes the most sense and record it here, or put not reported to indicate that there is none. Lastly, please copy and paste the details about the clinical condition from the inclusion and exclusion criteria presented in the paper. Only that which is related to the condition is necessary. We don't need to know that patients had to be above a certain age, but we do need to know that they had to have these kinds of presenting symptoms. Our panel is interested in chronic pain and opiate use prior to enrollment in this population. In columns M and N, if reported, we would like you to record the percent of participants with a chronic pain condition prior to their acute injury, and the percent of patients who came into the study on opioid medication. We mean opioid medication unrelated to the study. People on opioids for something else and happen to be taking them when they were enrolled. If the study randomizes patients to opioids, this is not the section where we record that information. If the study excluded patients with chronic pain conditions or on opioids, please note that in these fields. Otherwise, use not reported. Also, please don't put a percent sign into this field. So if the number was 70%, please record 70. After each section, there is a place for comments. You can add anything that you feel may be important but was not captured in the questions. Our next section is trial characteristics. First, note the type of trial and the number of arms. For type of trial, you will notice there is no option for a crossover trial, as these were excluded from our study. If you come across a crossover trial, please notify us. We will note for each arm the treatment, dose, details, duration of treatment, and number randomized. For the name of treatment 1, enter it into column R exactly as the study calls it, usually in the abstract of the paper. Then in the details section, copy and paste all of the necessary details of the treatment. There is no need to be concerned about the amount of text. The statistician will use what he thinks is valuable and ignore the rest. And make sure to copy and paste it rather than paraphrasing. Dose is only relevant to a pharmacologic treatment. Enter the dose and then the unit in parentheses. For treatment duration, make sure you are entering the duration of time that patients were on treatment, not the duration of follow-up. They can be different. For instance, patients can be treated for 2 weeks but followed up for 3 months. There is a separate place in the outcomes sheet to record follow-up times. Last, enter the number of patients randomized to this arm. Repeat these steps for arms 2, 3, and 4 if applicable. You can enter any additional information in the comments sections. Please remember to fill out not applicable in the cells for extra arms. The next section is risk of bias. In this section, we have questions about sequence generation, allocation concealment, blinding, loss to follow-up, any other bias you may perceive in the paper, and this is where we are recording the source of funding for the paper. Your drop-down menu options are definitely low risk, probably high risk, and definitely high risk. If we return now to our risk of bias sheet, you will see that we provide instructions for assessing each risk of bias domain, giving conditions that should be met in order to give a certain rating. Please follow these instructions closely and don't go off script. For blinding, we would like you to assess the blinding status for participants, healthcare providers, data collectors, outcome assessors, and analysts. We provide our definition of these groups in the sheet. Please use our definitions as we have stated them, which may be different from how you've conceptualized these groups in other projects. Please note there are different instructions for blinding with placebo and sham trials versus non-drug trials. A drug trial might be acetaminophen versus NSAIDs or NSAIDs versus placebo. Sham trials could be something like acupuncture versus sham acupuncture. Non-drug trials would include something like acupuncture versus physiotherapy or an ankle brace versus ice. If there is a drug in one arm and a non-drug modality like physiotherapy in the other, treat it the same way as a non-drug trial, unless they've gone to incredible lengths to both placebo and sham control the study, which they probably didn't. This guidance should enable you to fill out all of the sequence, allocation, and blinding questions. In these extractions we have as examples, I've included a quick reason of why I selected what I did. Moving on to loss to follow-up, the only options here are high and low risk. You should select high risk of bias if there's more than 20% missing data at follow-up, and this is across the entire sample. Any other sources of bias. Here you can report anything else in the study that could put the study at risk of bias. Here I've reported some information about unequal loss to follow-up across the study arms and different follow-up times for different outcomes. Record anything that seems like it could matter and we'll consider it. Last in this section is source of funding. This is a drop-down menu. We have options for being funded by any industry or no industry. So if the study received funding by industry and non-industry sources, we would say any industry. We don't have an option for partially industry funded. There is an option for an explicit statement of no funding and an option for funding not reported. The last option is a special option, which is that industry provided the drugs or potentially the equipment for the study, but they didn't give funding in any other way. If you see this special circumstance, please note it accordingly.
Now let's have a look at the Outcomes worksheet. You may remember that this review is meant to inform a guideline on treatments for acute pain. The panel for this guideline has decided that only certain outcomes are of interest, so we will not extract other outcomes. In the event that your paper reports two of the same outcome, For instance, pain reported in two different ways using two different tools. The paper will come with instructions on which of the two pain scores we would like you to extract, and you can ignore the other. The outcomes of interest are pain, reported as a continuous outcome. We will not be recording binary pain measures, such as the proportion that had certain percent reduction in pain. Function, again, we are only interested in function as a continuous outcome, and we will ignore any binary outcome. Health-related quality of life as a continuous outcome. Satisfaction, here we are interested in continuous and binary outcome. There are separate columns, as you can see, for continuous and binary. Return to work, both continuous and binary, again in two separate columns. Proportion of patients with relief as a binary outcome only, and re-entry as a binary outcome only. We have set up the sheet so that you will abstract data for one arm in each row. Please number the arms and use the same order that you used when filling out the trial characteristics in the general worksheet. We will start with pain, the first continuous outcome. All continuous outcomes will be filled out in the same way. The first thing to record is the name of the scale. For instance, Visual Analog Scale or McGill Pain Questionnaire. A definition of the outcome can be added if necessary. Then you need to provide the direction of scoring. Here you have two options: higher score is better or higher score is worse. Next, please provide the range of this scale. Sometimes this information is very easy to find or told in the paper, for example in the methods section or in the results tables. Other times you may have to Google the outcome measure to find out. Then we will ask you to report the follow-up time in weeks. If it is reported in a time frame other than weeks, use a Google converter to translate to weeks. If the paper has multiple follow-up times, we ask you to choose the last follow-up time for each outcome. This could mean the follow-up time for different outcomes in the same paper are different. For instance, in Bleakley, most outcomes were measured at 4 weeks, but the paper provided information at 16 weeks for some other outcomes. Carson score and adverse events are reported at 16 weeks. Next, report the number of patients analyzed in each arm. The number may differ from the number of patients randomized because of loss to follow-up. Ideally, we would like you to prioritize a complete case analysis where they report results only for those who complete this study and do not use imputation. More likely, of course, they will present one analysis, and that's the one you are to record. Please check carefully for the number of patients included in that analysis. It is also possible that the numbers will be different for different outcomes. Next, we have the baseline and follow-up scores. We first ask you to tell us what type of measure and variability are used. In the case of both our practice articles, pain was reported as mean and a standard deviation. Then please record the baseline effect size and its variability. You can enter either a number or a range in this field. If variability is reported as 95% confidence interval or IQR or range, please enter both upper and lower levels in one cell and in brackets. The reason is, if you don't use brackets, it may change to a date format without you noticing. We then ask you if it provides an end or a changes score. In the event that it provides both, please report the changes score. Then report the follow-up effect size and its variability. Repeat for the rest of the arms in the study using 1 row per arm format. There's a section for comments if there is anything of importance that you need to mention. While filling this out, please remember to enter the scale name and range for each outcome and each arm. Please do not leave any cells blank. Binary outcomes are similar. First, you should provide a definition of outcome. You can see, for example, for satisfaction, the authors measured satisfaction on a 5-point categorical scale, which we would have reported as continuous, but then reported satisfaction as either satisfied or not satisfied, depending on what they've answered. So they turned it into a binary scale, and we report it as such here. For the return to work, this paper reported the number of patients that were on partial or complete sick leave, then you will enter the follow-up time, number analyzed, and number of events for each arm. Re-injury is a binary outcome, but it can be both an outcome and an adverse event. This outcome and the way we need it reported is of importance to the panel, so be careful with it. We will count re-injury as an adverse event if it occurs during treatment. If it occurs after treatment ends, it should be considered an outcome. This first example paper reported re-injury both during treatment and after treatment, so we have recorded both in the sheet. The panel is also interested in patients using opioids at the end of this study. If reported, please indicate the number of patients that were using opioid medication in each arm at the end of this study period.
Our last section is adverse events. The first question is whether the study reported adverse events. We have a drop-down menu with 3 options. First option is no, adverse events are not reported. In this case, nothing more is required. The second option is yes, the study reported that no adverse events occurred. You may have to check the results in discussion for a statement that there were no adverse events, and if this is the case, no more is required. The third and final option is yes, the study reported that adverse events did occur. You would then proceed to fill them out. There is a very important difference between options 1 and 2. If adverse events aren't listed in the paper, please make sure to check very carefully whether they're in fact not reporting adverse events or that they did report that no adverse events occurred. And last, please make sure you fill this out for each arm and don't leave any spaces blank. For adverse events, we are only interested in binary outcomes, as in the outcome occurred or it didn't. We have seen studies where adverse events are reported on some kind of scale or as a continuous outcome. If that's the case, don't report it. Adverse events are otherwise reported in the exact same way as binary outcomes, which we have already covered. We have found that most studies in this area tend to report only a small handful of adverse events. We've provided you with space for 4 adverse events. In the event that you have a couple more, what we would like you to do is copy and paste the columns and add in the new adverse event. If you end up with a study that has a large list of adverse events, more than 10, please let us know and we'll check the study and decide whether we need all of them captured or not.